Hi, Stuart Carter here, registered massage therapist, manual osteopath, and starting in January of 2016, certified matrix repatterning practitioner. Today I'm going to be doing a demonstration on matrix repatterning, and this is my model here. Her name is Jill, one of my coworkers. You can say hi if you want. Hi. First I'm going to start with just describing this matrix pulse unit. It's a little handheld unit. It's an inductively coupled electronic stimulator, or an advanced portable PEMF, which is a pulse electric magnetic field. It has it's run on a 9-volt battery. It has an on-off switch, and it has 4 settings: low, medium, high, and extra high. And we use this unit to help to, 1, assess, and 2, treat the client when we're doing matrix repatterning. It has these pads have a flat side and a bumpy side, and so there's 3 configurations we can use on the body. You can do side by each, cross the body, or what one I like to do the most is putting the bumpy sides together and having it in my hand in some sort of fashion and using it as a treatment, because it has a pretty good treatment zone about this big. And so this is a really handy device. It was made specially for matrix repatterning, and they're at the University of Michigan down in the States. So we use that as part of an assessment tool. What happens with matrix repatterning, there's a tensegrity matrix through the body, which is connective tissue that connects from the top of the head down to the bottom of the feet. It's interwoven, and it's constantly communicating, sharing information with the body and tone throughout the body. Along with the central nervous system, or the nerves, along with the muscles, ligaments, even blood and lymphatics, there's constant communication and information that's being taken through the body. When you have trauma in one part of the body, it could be the knee, the hip, somewhere you fell or twisted something. It could have been a week ago, it could have been 5 years ago. You have stored energy and trauma in that area. It can start to creep into other areas and affect, so if something's happening in the hip, it can start affecting the ribs or even the knee, and then 5 or 10 years later you can have a problem with the knee when the real primary cause or lesion is actually in the hip. So by using this matrix pulse scanner, and another technique that we use with it is, and just put your hands here, it's some of you may have heard of applied kinesiology or muscle testing. This is an advanced, modified, it actually assesses the tone versus the muscle, so the tissue tone or resistance in the body. So you can pick anywhere. It can be the thigh, it can be the ribs, it can be the shoulder, and you're looking for a benchmark resistance. As a practitioner, I push in and I feel a certain amount of tone or resistance. I know that's a benchmark. And then when I use the matrix pulse, it amplifies that pulse to the body, and then I can assess certain areas of trauma once I get to them. So what that would look like, I'm just going to turn this on, and this is already preset to Jill's body. Can you bring this thing up there for me? So I'd find a benchmark by pushing into her ribs here, lower ribs. I found the resistance area there. And then I would just start scanning the body. I touch the body with my fingers, and I hold it in, and then I push down at the same time. Go to the next area, and there's 35 landmarks in the body that I would assess. And then once I'm done the 35, I sort of pick the different areas in the body that I found was the worst. What the worst feels like is when there's less tone. So the body communicates the information, I get to an area of trauma, when I'm pushing on the ribs, it actually softens. It can go down 1 millimeter or 2. For me, I would then know that this is a primary area of restriction. Let's say it was her knee. Once I figure out that it is the knee, then I can figure out what specific area is involved. I can put the matrix pulse around my finger, and again, I can apply the pressure here, or I can switch to her thigh at that time, find the resistance, sorry about that. And then I would just keep assessing the knee. Is it on the fibula? Is it on the femur? Is the patella? Let's say it was the patella that's showing up, so that's going to be softer in this hand. I would find which vector it is in, side to side, top to bottom, front to back. So again, those are his X and Y axes. Once I find out the area that is the problem area, this is the ease of the treatment, is I do something that's called containment. I work, let's say it was in this pattern here, this vector, I would contain the area and just hold it for a minute or 2, depending on what the body would want. And so what I would feel as a practitioner is a coming in and then an expansion, and a release would happen. When that happens, I feel like it's gone. I can then reassess the area, and often I'll find that the tone has come back to normal, indicating to me that the area has been rebalanced and brought back into a normal state. And you can do this throughout the whole body. Once you do an assessment, you can find 3 or 4 different primary areas of lesions. A typical treatment is 45 minutes, and you can work 2 or 3 of those areas in one treatment. And then it's like peeling an onion. Primary restrictions and lesions start to release, secondary ones come up, and then eventually after a few treatments you start to release all those, the body starts to come back into complete balance and function better. Overall, it's an amazing treatment. Like I said, I might work on the feet one day, I might work up into the head, and different bones in the head, or the neck and shoulders, wherever the body has taken me. For example, we were working on a lady recently who had stress and trauma up into her neck, or pain and trauma up into her neck and shoulders for many years. We did the global assessment. We realized there was one specific area right here on her shoulder where there was showing pain. She wasn't experiencing pain there, but when we used the matrix pulse and did the assessment, we found that this was an area of lesion. Once we talked to her, we said, "Did you ever have a fall?" She's like, "Yeah, when I was a child, I fell out of a tree and I hit a root right on my arm like this." So that was an indication to us, hey, we're onto something here. We treated the arm, and we also treated the ribs, because that energy got stored into the ribs. Once we treated the arms and ribs, the shoulder and neck pain really subsided that day. For at least 2 days, she was feeling amazing. She had never had where she didn't have pain in her neck and shoulders for several years. So there was a nice indication that we're onto something. So the matrix pulse scanner and the matrix repatterning treatment together can be very specific and help to, one, assess, and two, treat the body really effective, efficiently, and reliably. And it's cost effective because it's only 45-minute treatments, and you're able to get through the whole body in not very many treatments. Depends on what's going on overall health. It could be 4 or 5 or even up to 10, sort of depending on what we find and how much trauma you have in the body. So hopefully that answers any questions you may have about matrix repatterning. Thank you so much. Have a good day.